Can I now record?
You want a Yana shirt?
She's recording. Okay, PowerPoint, we're on page 14. Common injuries and disorders. Okay. Common injuries. First one is fracture. And this is for future reference. Whenever you hear the word fracture, I feel like a lot of times we think a fracture is just like a crack in a bone, and a break is when you actually break it all the way through. But in medical terminology, a fracture is just a fracture, whether it's cracked or broken all the way through and sticking out of the skin. Okay, it's still a fracture. And so that's one thing to note. I hear people all the time, they're like, oh no, they didn't break it, they just fractured it. That's the same thing. So, anyways, good show. All right, so different types of fractures. The first two I want to talk about is simple versus compound, and it's not written on here, so we have to. So simple just means that it stayed in the skin. Okay, so it's closed. They broke their arm, but the bone, none of the bones are exposed. Compound means that there is a bone exposed. It's actually broken through the skin, and you can see it. It's usually pretty gross. Those are kind of your two basic types. A green stick fracture. Why do you think that's called, looking at it or looking at it in your book, why do you think that's called a green stick fracture?
Because it looks like a tree branch.
Yeah, it does. So, okay, think about it. Yes.
Because it looks like a tree branch.
Wow. So, you know, if you've ever picked up a limb that was still really green and you try to bend it, what happens?
It bends.
It might bend.
Only a little bit, like only the top layer, like crashes off.
Yeah, usually, right, you try to bend it and like some of the layers kind of split and part of it will still stick up. You have to like twist it and try to separate it. Okay, so green stick fracture, it works kind of the same way. What population would you expect to see a green stick fracture in?
Kids.
Yes, why?
Because their bones become flexible.
Exactly. Their bones have more collagen. Okay, they're much more flexible than adults. So yeah, green stick fractures you typically see in kids versus adults for that reason. Good. Okay, stress fracture usually occurs as a result of like overuse or usually, like says, it's an incomplete break. So it doesn't necessarily break all the way through, but a lot of times it has to do with a lot of force. So where would you expect to see some stress fractures then?
Adolescents doing
Like boxing.
Could be, yeah.
Boxers,
Doing-
wrestlers.
doing sports like soccer and
Yeah.
basketball,
Some martial arts.
Yeah,
Rugby.
basketball.
hockey, lacrosse.
What else?
Conditioning. People that condition their.
A lot of endurance-related sports.
MMA fighters.
They probably just like comminuted and everything else. Definitely. Elderly, you see a lot of compression and stress. Sometimes you'll hear these called compression fractures or stress fractures. And that is from osteoporosis, which we'll talk about in a little bit. But over time, those bones just can't carry the same weight because they're not as strong. And so they just kind of crush. It's almost like a crushing type of, or can be like a crushing type of injury too. You hear a lot too about people getting stress fractures in their feet. That's usually an overuse injury. So either they've worn the wrong kind of shoes, or they just, the way that they're working out or using or on their feet a lot or whatever may cause that over time. Okay, a comminuted fracture is where it just splinters, so it breaks into lots of pieces. Usually to fix that, you have to have surgery to put in plates or screws to get it all, put it all back together. So I used to see a lot of these when I worked in the emergency, not the emergency room, Whenever I was in nursing school, I did a one semester. My clinical rotation was on the orthopedic floor. It's not my favorite floor, but anyway. And a lot of people on that floor had external fixator devices, which is like for if you have it on your head or for your neck, it's like a halo. We had a kid a couple years ago.
Zach Ryan.
Yes,
Mm-hmm.
from a neck fracture. So had a halo. But so they can have those on like your leg or your arm too, where they actually have pins that go all the way into the bone from the outside. You can see them. And then they have like a little, like a titanium or a
On their arm?
plastic arm or leg.
That's what my friend got. He had a pin going in his finger.
Oh yeah, I was gonna say, my friend had one.
So,
So it just stuck out of her finger.
Yeah. That's a little
Like-
white end.
Cause she moved it
the ones on,
like that, but like.
see if I can find,
That would hurt. Oh,
I'll show you a picture. Open reduction. Yeah, some of these are really kind of gross, but I'll show you. Open reduction internal fixator is where they use screws or plates on the inside. Okay, so this is kind of gross, but you see them using some there. An external, let's do external. External, here's some examples of external
That's great.
ones. So, yeah.
I would hate
Sorry about it. It's not pretty, but you can see the pins going in, and it has this to help straighten it. Ooh, during surgery. Yeah. So, that one's like straight from above. Ooh,
That's what you're looking
that one was gross. Okay.
It feels like
Anyway, a lot of times, depending on, and this is one thing, if you guys ever get an injury, especially if you think something's fractured or an open injury, make sure you go on to the doctor, because if you wait too long, they can't fix it, especially something that's open. So if you have like an open wound and you wait longer than 12 hours, they can't close it because there's too high of a risk of infection. I don't know if it's 12 or 24 hours. You have to look that up.
I'll just go out just to be safe.
But
I would
it's too
just
high of a
go
risk.
right
So if they
in.
were to close it and there was bacteria inside, then it would abscess and cause more issues.
And it would smell bad.
Yes, it would.
Ooh, just think like that.
All right, spiral fractures are just like what they sound. They have a spiral type shape to them. So usually you see spiral fractures, a lot of sports injuries, you might see a spiral fracture where it's like their leg or arm goes one way and the body goes another way. Sometimes you'll see it in child abuse especially. But
Because they pull their arms.
yeah. And it just kind of depends. Sometimes instead of that, you'll see, I don't know, child abuse can look like a whole lot of things, so you never know. But those are a few. Skiing accidents end up in spiral fractures a lot of times because you think about a ski going one direction and your body going the other. Football injuries, things like that. So, a couple more I wanted to add that weren't on here, or one more, is an avulsion fracture. And this is where a tendon or ligament, actually you injure it and it pulls away a piece of bone from a joint. So like maybe the corner of a bone or the edge of a bone that pulls it away with it.
How do you spell it?
Avulsion, A-V-U-L. Wait. A-V-U-L-S-I-O-N. Come on here, you on the phone? Yeah, put it up. Okay. So takes a piece of bone with it.
A ligament,
Ligament or tendon, yeah. All right. Okay, epiphyseal injuries. What's the epiphyseal plate?
It's on the
Oh,
end of
what is
long
it?
bones.
It is on the end of long bones. What is it?
Is it
Growth
the round
plate.
part?
It's the growth plate.
Yeah.
That's a little piece of cartilage. Did I ever show y'all that? I showed y'all that picture, didn't I? With the growth plates, the little skeleton picture.
Oh, yeah, you did.
I don't think you showed me.
You should.
That's probably because you were absent.
Did you show it last Wednesday?
I don't know. No, I definitely didn't show it last Wednesday.
Yeah, I haven't seen this before.
Oh, we saw that.
So,
See if I can. Here's a really good picture of trabecular bone, spongy bone.
Oh, is that the one with the neck that you said?
The neck,
Oh, you said it has a
I
neck
don't
looking
want
thing and
this.
then like
the femur.
yeah.
When I say bacon, you say Ritz. Bacon, Ritz. Bacon, Ritz.
She started that when you got it.
All right, I guess that's all. Just looking to see if I have any other interesting ones in here.
I still recording.
Are you still recording?
Yes.
It's like mid-video, we ain't even talking about that. Hello, class. My name is Miss
All right.
Bird.
So yeah, growth plate. That can be a major issue if it's broken or your bone is broken at the growth plate. If you're still growing. Now once you get to be an adult, you quit growing and your growth plates fuse and turn into bone. You know, it's just like any other part of bone. But specifically when you're young, if you have a break across a growth plate, then it can actually stunt growth in that bone. So it's really important to get it fixed the way it needs to be fixed. Because that would be an issue. Overuse says that acute injuries can damage the growth plate too. So I think it's one reason it's really important that really young kids aren't pressured into working hard and lifting, not working hard, but like doing a whole bunch of weight lifting and things like that, because it can really cause a lot of injuries, overuse injuries particularly.
Like the progressive era, you know, child labor.
I mean, okay then.
It's true, listen.
Can cause it to close prematurely. Those kind of injuries can. There's another disease that talked about in here called osteochondrosis, and you guys may know somebody. There was a friend of mine in high school that had this. It's also called Osgood-Schlatter disease. And I saw this in particular in guys. There was one or two guys in my class that had it that grew really fast, like in a short period of time, they grew a lot. And this particular injury has to do with a lot of like working out or weightlifting during that time period of like a really fast growth spurt. And it has to do probably with the inflammation of where the quad in your thigh attaches to the tibia, the front of the tibia. And so you'll see, and they'll have a big old knot. I mean, it might be like the friend I'm thinking of, this was like this big and like this big, right on the front of his knee, right here, at the front of the tibia. And really tender. I remember complaining about it a lot in high school. So, yes.
Is that, do they know when that growth spurt is, or are you just like unlucky?
I guess you're just unlucky when it happens. I don't know. I think you can grow out of it, though. I don't think you have it forever. But it becomes really swollen and irritated. Tends to happen more in boys than girls. Probably because for girls, that initial growth spurt usually happens more in like junior high time period, when you're not necessarily working out quite like you do in high school, especially for athletes. You still work out, but it's not nearly as intense as high school. And for guys, that growth spurt may not happen until 14, 15, 16, 17 years old. So, a particular cartilage, remember, it's just the cartilage that covers the end of the bones, or it can include like the meniscus and the disc of cartilage between femur and tibia. So that's another area that injury can occur. And then the apophysis.
Oh, no, I got this one. It's the site where the tendon attaches to the bone.
That's right. Where the tendon attaches to the bone. So osteochondrosis then is one example of an apophysis injury or disease. Disease, I guess. More of an injury. Very good.
I think that deserves candy or something.
You have the candy corn.
Osteoporosis. So what words do you see in osteoporosis?
Osteoporosis, softening.
No, that's Malaysia.
We haven't learned Malaysia. Oh, yeah.
Yeah, we learned Malaysia. That's on our last name. Porosis.
Osis is, or cis, remember that one?
Inflammation
Yes.
or infection.
That's
No,
condition.
no, that's
Condition.
itis.
All right, abnormal
Yay!
condition of bone, and then pore.
It's condition where bone mineralization and strength are abnormally low.
That's right.
That's crazy.
But poor in there would mean
Low, abnormal.
it just means poor. Like abnormal condition of bone pores. So specifically like that spongy bone that I showed you, instead of being really nice and strong like this, it starts to break down and looks like a broken cobweb or something.
It looks like it's made of fortune cookies.
Boy.
Fortune cookies.
Yeah, on the
What
right.
kind of fortune cookies are you eating?
I'm saying if they were shaped like that.
Shh, Cody.
I didn't get a fortune cookie out of that, but whatever. So, but yes, so osteoporosis, so abnormal condition of bone pores. So really, what problems do you foresee with that issue?
Brittle.
Stress.
Brittle?
Stress, fractures.
Stress fractures, like we said earlier.
Old people.
Makes you think of old people.
Oh,
Yeah,
hips.
there's a reason for that. Hip
Like
fractures.
walking up the
particular.
stairs or something like that. Break her.
Yeah.
Suplex.
So definitely an increased risk of fractures, right? Because it's just not as strong. Okay? It's much more brittle. I think of it as like them kind of like drying out. I don't know why I think that. That's not really how it works, but but much more brittle, easier to break, less minerals, right? It can't contain. I mean, it can't store as many minerals because there's just not as much bone. It's broken down.
Where does the bone go?
It gets broken down, absorbed into the bloodstream. That calcium,
So like,
osteoclasts
can you
break it down.
prevent that?
Somewhat. Now you can't prevent it altogether because the problem is all of our bone mineralization peaks. So for guys,
That's Cody.
I know. So for guys that peaks like in the early 30s, and for girls it's usually like mid to late 20s. And from then on, basically bone mineralization just goes down.
And I don't get how girls can outlive guys. Like we grow slower. Like all that stuff happens, takes longer for guys, but girls go through faster, but they live longer.
And less mineralization, so less strength, less density, and increased risk for fracture. Occurs mostly in the elderly, especially for women. Women usually have an onset much earlier than men. And that's because women's bones are less dense, typically, than men's. And it has to do with menopause as well. So menopause, estrogen plays a role in how our body absorbs calcium. And so for women in particular, when the estrogen goes away at menopause, can lose some of that ability to really absorb calcium and absorb vitamin D and keep it. So that's that. So at 60 and above, usually if people have fractures, if they're 60 or older, they usually have something to do with osteoporosis. Hello? Yeah.
I hope it's for me. Please be for me.
Oh, what'd your dad say?
He was asking about Mr.
Yeah. Hey, Molly, you're still looking yet.
Where you going?
I think it's about it's about money. Yep, it's that in general. All right. Kyphosis is another disorder that occurs because of osteoporosis. So all of y'all seen, what do they call it, a widow's hump? Or
Nope.
this, like where the thoracic curvature right here goes way out. Yes, older people, especially older women.
Maybe like the hunchback.
Like the people that are like
Yeah.
this.
Oh my
Like
gosh.
that, yes. That curves way out. I think he was born with it.
Oh.
Yeah, technically. He was a real person. Much fat.
Notre
I don't
Dame.
think so. I mean,
Anyway,
crazy.
that's called kyphosis. Okay, lordosis is an inward, like an overly inward curvature of the lumbar spine. But kyphosis is where kind of
Oh,
that
that hurts my back.
humpback look.
Heard of widow's peak.
Roast beef.
Okay, and there's 3 types of osteoporosis. Type 1, this is known as postmenopausal. Fractures usually begin to occur about 15 years after menopause, which could be, I mean, it's anywhere from like 45 to 55 is
What's
usually menopause age. Menopause is where women lose their menstrual cycle, quit making estrogen, a lot of hormone changes. Usually happens between, I don't really know the official age that the book would say, but somewhere between 45 and 55. So that's one reason that women take hormones even beyond that. I mean, take hormones orally or topically is because of the risk of osteoporosis and the bone demineralization. So, but both of them carry their own risk. The hormones carry their own risk too. So, more hormones you take, the higher your risk for breast cancer. But so it's kind of a
Yeah, but there's not a single trace of breast cancer in my family.
not one. I didn't think
I
there
don't
was
think
one in
so.
mine, but my grandmother, had it last year. But the
My
doctor told her,
grandma-
he was like, "You're 91." He was like, I mean, it was just a matter of time before you got something. So it's like, anyway. Type 2 diabetes. Type 2 osteoporosis is age associated, so it says affects most women and men over 70. But one thing that you hear a lot about is sometimes all it takes, especially for a really elderly person, it's like they break their hip and they just kind of go downhill from there.
Yeah.
That happens a lot, or just some kind of injury. And a lot of that is, especially with hip fractures. So hip fractures can happen anywhere, but a lot of times, especially if they're osteoporosis related, they're right at the neck of the femur, because that area obviously is a lot thinner than this area and this area. And it's that trabecular bone, so if they have osteoporosis, then that area is going to be weaker anyway. But sometimes people break, they can break it here, they can break it inside here, they can break the pelvis, they can break this out here. So there's lots of areas. But the thing is, when you break your hip or when you have like a hip replacement or something like that, they have to keep your hip immobilized for a really long period of time. And so that makes a lot of people bedridden. Well, for elderly, when they're bedridden for, a long period of time, their muscles atrophy so fast. And they just lose strength really quickly. And especially bone density, that's another thing they lose.
I'm all about strength.
How do you think this through, how do you think you can prevent osteoporosis?
Drink milk.
Okay,
Eat your greens.
yes. Drink milk, eat your greens, right? Stuff that has calcium, vitamin D in it.
Get outside and get in the sun.
Orange juice.
Yep.
Let's see.
What else? What kind of exercise would you do?
You do the
Cardio?
medicine ball.
You could do the medicine ball.
Cardio.
That would be good.
Triceps.
Yes, for cardio. What about swimming?
Oh, you have to keep
No,
your
I'm
muscles,
asking.
your emotion, or reacting.
I'm just asking.
First, you have to learn how to swim.
Acting. Okay, well, swimming would not be a good option for osteoporosis. Think this through.
Oh, is it because of the chemicals in the pool?
No. But good try. Think this through. Okay, what makes your bone stronger? We talked about calcium and diet. What else makes your bone stronger? We talked about this the other day. Maybe you read
Microscopic
about it.
fractures that repair themselves.
Do it.
Microscopic fractures
Okay.
that repair themselves.
Yes.
That's
exactly
what those
right.
Thai people do. They
Remember I
kick
talked about osteoblasts and osteoclasts. Osteoblasts build bone up and osteoclasts clear it out. Remember, and puts calcium into the bloodstream.
you.
Well, the more you work out, the more weight-bearing exercise you do, because that has the gravity and the weight on the bones, the more the osteoclast will tear down and the blast will build up, which makes it stronger. So weight-bearing exercise is the best exercise for osteoporosis. Swimming is not going to do much to prevent osteoporosis. Doesn't have enough weight with it.
Squats.
So, yeah, although I don't know many 70-year-olds that do squats, but that would be a good example. But that's why walking really is a great exercise for elderly people. It doesn't have a whole lot of risk with it, but they're still able to get in like some weight-bearing exercise.
My grandma fell off the curb like 3 times. So she scrapes her elbow every time.
So weight-bearing exercise and calcium intake. Okay, the female athlete triad. Oh my gosh. Female athlete triad is under 144. The 3 things it includes is disordered eating. So just not eating the way, and that can look like lots of things. It can look like anorexia. It can look like bulimia. It can also look like
Not eating healthy, like chips and stuff.
it could include that. Not so much as bulimia doesn't necessarily have to just, I know it makes you think of, they throw up right after they eat, but that's not necessarily what bulimia looks like. I think a lot more people are bulimic than they even realize. But it can, this said that bulimia nervosa involves a minimum of 2 eating binges per week for at least 3 months. So binges is where you just like go crazy and binge eat a whole bunch at one time. Then usually feel guilty after that. So either try to throw it back up, or throwing it back up, taking a laxative so that to get rid of it, self-induced vomiting, what else did it say? Oh, taking diuretics, really strict dieting, or over-exercising, or just an obsession about body image or weight gain. And anorexia really is not eating. But the other part of this is amenorrhea, which is where girls stop having their menstrual cycle. A, remember, is without amenorrhea. That's what is menses. So that's another sign of this female athlete triad. And then osteoporosis is the other one, just because of the lack of diet and the lack of care, really. So that's one. There's something interesting. Common joint injuries, sprains, are injuries that are caused by abnormal motion of a joint. So it could be a tendon or ligament injury. Usually swelling and pain are the signs. You guys know what sprains are. It doesn't have to be torn. It can just be overstretched as well. Doesn't always necessarily mean it's torn. Usually in the ankle, it's in the lateral ligaments. Where would your lateral ligaments be?
On the side.
On the sides, right? So your outer ankle.
Like your
That's usually
fibula.
where you see it. Yes.
Not good.
No. Let's not say that too
I
much.
did say fibula, didn't I?
The other day you did.
You said it right.
I said fibula the other day.
Oh, I just missed it. You did that on purpose. Dislocations. Bone is displaced from the socket.
Oh no.
Oh my gosh.
I heard that.
Oh.
She said it.
So common sites, shoulder, fingers,
Oh,
knees.
I can't dislocate.
Yeah, don't try to do
Yeah,
that.
please don't do that.
Elbows, jaw, those are areas of dislocation. So the reason you think about, somebody was asking earlier about a fracture versus a dislocation. It really depends on how much muscle involvement there is. Okay, so if I'm just laying on the bed and somebody jerks my arm out of socket, it probably is going to come out of socket. But if I'm in the middle of like lifting something and they were to, like if I'm using my muscles and my muscles are taut, then it's more of a risk of breaking versus a dislocation. Does that make sense? Because the muscles are holding it in place, if they're active. And so skiing a lot of times results in fractures, not necessarily just dislocations. Yes.
So with sprains, would that be more with like stretching and gymnastics and stuff like that?
Yeah, like when you roll your ankle.
So if you tear your ligament or tendon, like how does it
It usually
get repaired?
can fix itself as long as you don't keep injuring it. Usually will fix itself. Now, if you tear it all the way through, it won't fix itself. But usually you can't move it at that point. Like there's a lack of movement.
And so would they like
Oh, we have to do some kind of
surgically
surgery.
put it back together?
It depends on the tendon and ligament that it is too.
This one,
So
this one. Your arm right here.
Why?
The other thing with the dislocation is usually you see a deformity, pain, swelling. Obviously, they can't move it like normal. Bursitis is an inflammation of the bursa, which remember are those little bitty capsules that hold fluid that kind of help prevent friction. So over time, really, this is another overuse injury. That can really, those bursa can get irritated from too much friction. And then arthritis, there's actually over 100 types of arthritis. And rheumatoid is one that you hear of a lot. This is an inflammatory disease, like an autoimmune disease. So it's like your body attacks your own joints. So that's one example. It's really debilitating, and it can occur in children. You can have juvenile rheumatoid arthritis. There's a picture of it, I think, on page 146. This is one where you see a lot of times people have really a lot of deformities in their hands and feet, especially with rheumatoid. And they can actually, those bones can actually fuse together so the joint doesn't even function anymore. And then the last one is osteoarthritis, and this is like your normal, everyday, everybody gets it when they get older arthritis. You know, it's just, everybody gets it. Cartilage wears away, bone touches bone, causes injury and pain in that way. So swelling, decreased range of motion, lots of pain. And that's it. Okay, listen, this test will be Tuesday. Okay. Thursday next week will be the practical that has both quizzes on it, and you'll get your quizzes back.
We have a test tomorrow.
I did the true and false on the back. I think I need extra points. Thanks.
Okay, so make sure, other than that, you don't have any other assignments next week. It's just that 4.4 and 4.5 to do Tuesday. You're still recording. Yes, I am.
No, who am I?
Okay, so
Did you really
That's
get
that.
video?
Really? Can I go to Mr. Petty's class right